Hi, we're here at ECM Physical Therapy with Natalie, one of our pre and postnatal patients, and she's just going to answer a few questions about our office for us. So Natalie, what was your initial impression of ECM Physical Therapy and Dr. McDaniel?
When I first came to the office, I came because it showed up at a Google search for yoga lessons, which was not exactly what I was looking for, but I was looking for something to alleviate the back pain that I had. And I first met Dr. Ebro, who was extremely helpful in explaining to me what work they do in the office. And we booked an appointment, and then I met Dr. McDaniel, who immediately recognized all of my needs around any pain that I had in my back due to the pregnancy, which was also complicated in my case, and so I needed extra care, which after the first visit, it was a no-brainer for me that I would come back because of how well the treatment went.
So would you say Dr. McDaniel was able to identify and address your specific needs?
I would say more than yes, and I was impressed at how well Dr. McDaniel was able to identify them. After the first assessment session, she asked me several questions about the pregnancy, about what symptoms I'm experiencing with respect to my back pain, and was quickly able to alleviate the pain for that day, and then proposed a very nice treatment, including Pilates workouts to improve my condition.
And was there anything specific that you liked about the office and the treatments and the way the office treated you?
I generally like a lot that the office is flexible without being too flexible about appointments, that the technical expertise of Dr. McDaniels is excellent. She's one of the best physiotherapists I've been to, and I've consulted 5 because I have also sort of chronic back pain. The office is very well equipped, and the location is extremely convenient, at least for me, because it's in the heart of Midtown. It's on 42nd Street, so there's very easy access to it. I think that sums it up. Oh, and I want to say the Pilates equipment is also excellent and very on point.
So how would you answer if people are looking for Pilates or yoga like yourself, but ended up doing physical therapy? Would you say that it was something that you weren't expecting? It was better than you expected? It was different than you expected?
I don't know why I was not thinking about physical therapy when I came looking for. I think it was because in my mind I couldn't do physical therapy because I was pregnant. I don't know why I had this preconception, and then when I came here, it was actually sort of a blessing that Dr. McDaniel was an expert in prenatal issues, so it was definitely way above my expectations, and I wish there was a way to kind of communicate more that it's almost a necessity for a lot of women, especially those who work like me in an office, to do physical therapy while they're pregnant, because there's a lot of maybe pre-existing symptoms that can worsen and that physical therapy can alleviate, and especially in the hands of an expert such as Dr. McDaniels.
And can we ask you that you came to the office as a high-risk patient? What type of condition you had?
So on one hand, I had existing chronic back pain because of the conditions of my workplace. I work in front of a computer for 8 hours a day, but the pregnancy was also a higher risk, which put a lot more pressure on my back. I had 3 very large uterine fibroids, the smallest one being 10 centimeters and the largest one being 15 centimeters. And I want to highlight how careful Dr. McDaniels was to make sure that my condition is actually properly treated with respect to this high-risk pregnancy that I had. She consulted specialists to make sure that I have the best care, and I did indeed have the best care.
Okay, and was there any last words you would like to leave us with?
Absolutely. I want to, first of all, 1,000% recommend this office, because everybody here is very much experts at what they do. They care about the patient we have developed a relationship that's beyond just, you know, Dr. McDaniel's being my physical therapist, which I however, don't think it's something that they impose on me. It's just something that naturally developed, and I am such a person that I really like those kinds of relationships. And I also want to say that in the end, even though I had a high-risk pregnancy that doctors predicted that I would deliver early, I think in part, a large part probably because of Dr. McDaniel's care, I delivered on term a very healthy baby boy. So I'm very grateful.
Okay, that's great news, and thank you for your input and your feedback about the office.